I think patients who are having any sort of eye surgery get extremely worried for a number of reasons, naturally. Cataract surgery is a very common operation, so it's a very routine operation and very safe. There are problems with cataracts operations, as there are with any operation, but the risk of any problems is very small, so patients really need not worry. Nowadays it's done as a day case, so patients don't need to come into hospital overnight. They come in and have the procedure and then can go home the same day. In times gone by, when your grandmother had her cataract done, people used to be admitted for 2 weeks, bed rest, and had sandbags so they weren't allowed to move their head. But because of the new techniques, the recovery is much quicker, and then patients can really carry on pretty much from the next day as normal, with no major restrictions to their everyday life. Driving can usually be carried out a few days after the operation. You may need drops to use for 2 weeks afterwards. And in most patients, the operation is done under a local anaesthetic. And that allows, again, for a much faster recovery. You don't need the prolonged recovery of a general anaesthetic for most patients. Now, many patients worry about having an eye operation because they think they can see all the instruments coming to them. They think they're going to be able to feel things. But the local anaesthetics that we give are completely painless. You don't feel anything at all. And because the local anaesthetic also affects the eyelids, you're not able to blink, so people worry about blinking. They worry about moving their eye, and again the anaesthetic stops the eye from moving. But the anaesthetic also stops them from seeing anything. So you may be able to just see a bright light, or perhaps even nothing, but you won't see the operation being carried out.